So that is the briefing by Arvind Kejriwal, where he's in fact said again that there is a shortage of beds, there's a shortage of oxygen that needs to be addressed. Arvind Kejriwal saying that Delhi needs at least 7,000 beds with oxygen facility to be provided. He's also highlighted that he's spoken to both Home Minister Amit Shah as well as Health Minister Dr. Harshvardhan, seeking for help in the fight against coronavirus in the national capital. Kejriwal also pointing out the kind of steps that have been taken so far, saying that several grounds, some schools also have been attached to hospitals to ensure that there are more beds available. He's also thanked the central government, saying that everyone will join together and fight this second wave of coronavirus together. But let me just highlight for you the dire situation in the national capital and how cases have been going up almost every single day. Right now, Delhi is the worst hit city in the country, with over 24,000 cases being reported in the last 24 hours alone. And that's why Arvind Kejriwal again has come out with an appeal to people to do their bit in the fight against this virus. Let me put out the data for you. The national capital has witnessed its highest ever single day spike, with over 24,375 cases reported in the last 24 hours. So the active case tally in Delhi stands at 69,799 with 167 new deaths. Kejriwal has sounded an alarm, stating that that Delhi is running out of resources. He had held a key review meet yesterday as well, where Kejriwal has highlighted that there is a shortage of beds, oxygen cylinders and Remdesivir in the hospitals. He's spoken about that just a few minutes ago, saying that the centre and he's appealed to the centre to ensure that more beds are provided to Delhi. Meanwhile, you have the DRDO, which has decided to set up a 500-bed COVID facility near the Delhi airport. 250 of these beds will be made available by tomorrow, by Monday. Delhi is already undergoing a weekend curfew that's been imposed till Monday 6 a.m., under which only essential services are allowed to remain operational. Hotels, spas, gyms and some other centres are closed.
Delhi has witnessed an unprecedented rise in COVID cases, with more than 24,000 cases being reported in last 24 hours. That means 1 in every 4 person in Delhi is COVID positive. Also, more than 160 cases of deaths due to COVID has been reported. The government is struggling with hospital beds, beds with ICU and ventilator, and beds with oxygen. And this is the condition in Delhi when weekend lockdown has been imposed. Right now we are in Connaught Place, and you can see how a number of barricades have been put in the Connaught Place area to stop any unnecessary vehicular movement. The police has allowed only essential services to operate throughout the town, and the Delhi government is trying to convince people to stay at home to control the pandemic. This is Abhishek Anand reporting for India Today from New Delhi.
Let's get you the latest updates from Maharashtra. It's the worst hit state in the country, and in the last 24 hours the state has reported over 67,000 cases, and also the death toll is going up. Let me break down the numbers for you so far. 419 deaths that have been reported in the last 24 hours in Maharashtra, along with 67,123 coronavirus cases. That means that the active cases in Maharashtra has gone up to 6.47 lakh. What about the city of Mumbai? Mumbai has reported 8,834 new COVID cases with 52 deaths in a day. Pune remains the worst district after Mumbai with 10,963 new cases and 109 deaths in the last 24 hours, followed by Nagpur with 6,956 cases. Now, a fresh set of guidelines have also been issued by the Mumbai police for those travelling by their cars on roads. As per the order, only vehicles with colour-coded stickers will be allowed to travel on the roads from today. So let me just explain how that works. Under the red category is all medical healthcare workers, all staff who are supplying medical equipments, supplying medicines, etc. All vehicles that are carrying vegetables, fruits, bakery items, dairy products, basically all your groceries, should have a green colored sticker. And all the others who've been identified as falling under essential services category will have yellow stickers.
Maharashtra reported highest single-day spike in COVID cases on Saturday with more than 67,000 cases being reported with 419 deaths. Mumbai reported about 8,800 cases and 51 deaths. Death rate is also rising in Mumbai. Yesterday, Mumbai reported a shortage of oxygen in few BMC hospitals, and patients, including critical patients, had to be shifted out of those civic hospitals to other facilities. There is a political war of words between state and centre with regards to supply of Remdesivir. So all in all, there are a resource crunch in Maharashtra while it comes to treating the patients. On the other hand, the cases are continuously rising. With camera person Mangesh Amre, Mustafa Sheikh in Mumbai for India Today.
So cases are going up in Maharashtra. There's a curfew in place. The need of the hour perhaps is for the state and the centre to work together. That's however not the case on the ground. You've got a big face-off over the shortage of Remdesivir, the drug and its supply to the state of Maharashtra. The state government, the Uddhav government, has now gone ahead and ordered the Food and Drug Authority to raid centres that are storing Remdesivir injections across the state. This comes as Maharashtra Minister Nawab Malik called for confiscating Remdesivir stocks which are unused so that it can be given to the needy. Malik accused the centre of asking pharmaceutical companies to stall Remdesivir supply to the COVID-ravaged state. Now, Nawab Malik's remarks have sparked again a political storm, with the centre launching a stinging counter. Union Minister Mansukh Mandavia accused the Maharashtra government of issuing threats during a pandemic.
महाराष्ट्र सरकार खरीदना चाहती है तो बेचने वालों को रोका जा रहा है। हमें लगता है ये कौन सा रवैया केंद्र की सरकार अपना रही है? क्या ये भेदभाव का रवैया है? क्या महाराष्ट्र में रहने वाले भारत में हैं कि नहीं, ये केंद्र की सरकार को बताना पड़ेगा। हमने हमारे जो फूड एंड ड्रग एडमिनिस्ट्रेशन के मंत्री हैं उनसे चर्चा की है। उन्हें कहा है कि कहाँ-कहाँ ये स्टॉक है जानकारी लीजिए और सारा मामला सीज करके लोगों में तकसीम कीजिए।
And listen in to exactly what the centre's response was to Mr. Nawab Malik and his claims.
देश में 6 अप्रैल के बाद एकाएक कोरोना बढ़ा और डिमांड बढ़ी, लेकिन उस वक्त देश में रेमडेसिविर इंजेक्शन बनाने के लिए 7 कंपनी के पास लाइसेंस है। उसमें केवल 2 ही कंपनी प्रोडक्शन करती थी और वो भी उनकी कैपेसिटी से 20%, क्योंकि मार्केट में डिमांड नहीं थी। 38 लाख वाइल बना सके इतनी कैपेसिटी है। हमने सभी को कहा कि आप प्रोडक्शन चालू करिए और फुल फ्लेज में प्रोडक्शन चालू करो, लेकिन जब प्रोडक्शन करना है तब फर्स्ट फेज से एपीआई से लेके उसका फॉर्मुलेशन, स्टेरिलिटी टेस्ट, ये सब करने में 21 डेज लगता है। पर डे 1,35,000 वाइल आज के दिन में प्रोडक्शन में आ गए हैं। अगले 1 सप्ताह में 2 लाख तक पहुंच जाएंगे और 15 दिन में पर डे 3 लाख वाइल का प्रोडक्शन हो जाएगा।
Now, there have been a lot of questions about the reopening of schools. There's been a huge debate about whether it's safe for schools to reopen, for students to return. Let's get you details of what a Lancet COVID panel report on India had to say on this issue. In fact, this panel has said that reopening of schools without vaccinating teachers and assisting staff puts them at great risk of contracting the virus. The Indian task force recommends that school teachers and staff should be designated as frontline workers. It endorses that school teachers and assisting staff should receive vaccinations on a priority basis. Lancet Commission advocates that all classrooms, buses and other indoor spaces should be well ventilated with open windows and of course continuous cross ventilation. It advises deploying Teach for India groups to cope with sudden and prolonged absences of teachers who may fall ill with COVID-19. The Indian task force emphasizes the importance of social distancing in classrooms, time-to-time sanitization, and also advises that masks should be made mandatory about the age of 5. So we've been seeing for the last many days over 2 lakh cases being reported on a daily basis. And according to experts, the numbers could actually be much higher. The government has said that the reason we're seeing such fast spread and why it's so contagious this time around, or the second wave, is because there are new variants coming to light. And genome sequencing experts are saying that the way to arrest the spread of this virus, to ensure that we have the second wave under control, is to identify these variants at the earliest.
1,189 samples in India have been tested for variants of SARS-CoV-2, the virus that causes COVID-19. And these are variants of concern, says the government. This includes 1,109 samples with UK variants, 79 samples with South African variant, and 1 sample with the Brazil variant. The government says that genome sequencing has been done in over 13,000 samples and that we are in the process of testing more samples. At least 5% of all samples from states ought to be sent for genome sequencing.
Genomic sequencing will help us to identify the newer variants of concern. When done together, genomic sequencing and epidemiological investigation will help us to limit the outbreaks only to local areas. Thereby, we can prevent it from spreading to other parts of the country and the world, thereby avoiding many deaths.
In India, genome sequencing through a consortium of 10 labs started only in the month of December. Up until now, 13,000 samples have been sequenced, woefully less, say experts.
The double mutation B1617 is surging to be 60% in one pocket of India. But obviously that's not enough testing. You need sequencing on a large scale, like at least 10% of your cases to know what kinds of variants. And you need to sequence to know that are your lockdown measures, are your containment measures just reducing the old variant, or is it actually reducing the new contagious variant?
The India Task Force on COVID-19 has said that the government should be achieving its goal of testing 5% of all cases every month on a continuous basis through financial and regulatory support. They point out that New York City alone samples up to 1,500 sequenced cases every single week. Among other suggestions are equipping labs with TACPAT test kits to urgently identify the B.1.17 variant across states. The government of India insists that detection of mutations and of new variants essentially doesn't really change our strategy of testing, treating, isolating, masking up and following COVID-appropriate behavior. But experts say that it's extremely important right now to ensure that there is more sampling, more genome sequencing that's happening in the country to then understand how to arrest the surge in cases and also tweak our line of managing the infection either through repurposed drugs or the vaccine. In New Delhi with video journalist Waqar Ahmed, Sneha Mordani for India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.